Thank you for joining us again at the Sacred Birth Circle. Today's guest is someone with a very unique perspective as a NICU nurse who also unfortunately experienced a stillbirth. We hope that you will share this episode on social media so that we can continue to reach more families and help empower them throughout their pregnancy journey. Enjoy this episode. Welcome to the Sacred Birth Circle. I'm Anna Vick. Thank you so much for joining us again. Today's guest is one of my favorite friends. I think I say that every episode, and I actually do mean it though, because I love every one of these people that I've been bringing on. But Angelica is somebody who I've been connected with for a while now, sadly through our shared grief and our loss of our children, but also just in the work that we're doing now together. She's just a very strong advocate for change and prevention of stillbirth. And she also is with Count the Kicks now, as well as Push for Empowered Pregnancy. So we're working together side by side here in this battle against stillbirth. So I want to let you introduce yourself first and let us know a little bit about your backgrounds and what you do for work, which is kind of part of this story here.
My name is Angelica Kovach. I am a mother of three, one living daughter, and unfortunately two boys who I've lost to stillbirth and miscarriage, respectively. I am also a nurse. I've been a nurse for almost 10 years, and oh goodness, I want to say 8. No. It'll be about 6. There we go. That's the right number. 6 years have been spent in the NICU, the neonatal ICU. I have been with Push for Empowered Pregnancy for a couple of years now, and just started as an ambassador for Count the Kicks. So I haven't really gotten much, done. But I hope to be a strong advocate for change.
Thank you, Angelica. So first, I just wanted you to share a little bit about your job, because that's important for this story too, I think, and that you've seen kind of every type of outcome and scenario with, difficult births and the traumas that come in, and, babies that are quite small that survive. How has that been for you just as a job? I just want to hear a little bit, share your experience and, what that's taught you about birth.
I really loved my job. I have kind of a complex relationship with it now following the loss of my boys, but it's overall very rewarding to see these babies come to you, to stabilize them and to watch them go from being either very small, very sick to growing, thriving, and being able to go home in most cases. When you are oriented to the NICU, you are basically sent into a really in-depth look at neonatology specifically, because as with pretty much anything in school, you look at kind of the big broad picture when you get your degree, and then when you have a specialty, you need to learn a little bit more about the types of diagnoses that you'll be exposed to. When I first started in the NICU, I was actually pregnant with my daughter, my oldest child, and I was basically learning about all of the different things that can happen in pregnancy that might negatively impact the infant. And a lot of these things are the types of events that could lead to stillbirth, in addition to whatever complex means of hospitalization are required for our babies who do end up making it. So it's and we care for babies of every age and size. Age of viability is about 24 weeks. although we have had a couple of 22, 23 weekers that we have been able to stabilize and send home after very long hospitalization courses. I am very passionate about stillbirth prevention, though, because I see a lot of the near misses. Women that go to 40 plus weeks and you have meconium aspiration, shoulder dystocia, you have severe birth trauma because maybe the doctor doesn't want the C-section, or the mother doesn't want the C-section, and so using forceps with something like 18 pulls, or using the vacuum, and with the vacuum you're only allowed 3 pop-offs because you don't want there to be any head trauma. And we've seen instances where there have been more than that. We also have seen babies who were born either at home or at birth centers and are unresponsive and are stabilized in the ambulance or in the emergency room, and they're old enough, big enough that we can cool them. It's to prevent any more damage to the brain than has already happened. And for 72 hours, they are cooled, and then we very gradually rewarm them and then take a look at their brain function to make sure that there isn't any further damage. And some of the cases have been very, very sad. And so I feel like I'm on the wrong end of nursing if I want to prevent stillbirth, prevent these types of complications. But I find that it is helpful to see the types of interventions that we have to prevent stillbirth. If you know that there is an issue early enough, then you can be proactive. And so, yeah, that's me. I don't know if I fully answered that question.
That's definitely, like, I think you hit everything that I wanted you to in 5 minutes, so it's great. Like, what else are we going to talk about? But no, the story about the near misses is really interesting to me, because I think a lot of people who have good outcomes, but say they decide to do things a little bit riskier in their births or even the pregnancies, and then they can come onto social media and say, oh, well, my baby was fine, like with the nuchal cord around the neck twice, like that's no problem. Anyone can have birth wherever they want because my baby survived. I think it's hard because those people are not saying, like, what's the risk? Like, what was, they don't actually know possibly that they were a near miss. They might just think like, this is normal, like this is fine to happen this way. And so they have no clue, right, that their baby could have been in danger of a stillbirth. Absolutely. Or, maybe just developmental issues, and that's about it. But that's still hard, to grow up like that. So it's tough when you see stories on social media shared that are very glamorized about certain scenarios. And, we are all for everyone having the type of birth they desire, but we think you should know the risks involved. And I think knowing that, then you can really truly make an informed decision. I don't think it's an informed decision if people are just making it out to be very safe, very perfect, pleasant, beautiful, and not telling you that, if there is cause for concern and your baby needs to be delivered quicker, or has an issue after they come out, where are you? Like, you need to be in a place where you hopefully have the right team there ready for you. Even a NICU team, like the one that worked on my son, they were a lower level NICU team. And I always thought if I'd only gone to the other hospital with the higher level NICU team, who knows, he could have been here. So for me, it's really hard because I always think to myself, like, I wasn't thinking I was delivering that night. I was assuming I was just checking on him, and I was being kind of a crazy mom, freaking out over movements.
Yeah.
But, I really wish I had gone into the hospital that I had planned to deliver him at that had the higher level and seen, that they could do much more. I'm sure. I don't know how different the care is at a higher level NICU than where I
Well,
went, but
every NICU is every every nurse, at least in our state and in our health system, that interacts with newborns is required to take a or be certified in the neonatal resuscitation program, NRP, um, which is like basic life support, CPR, but it's very specialized. And so there's definitely a difference in the different levels based. It's more, I think, based on the level of acuity that the NICU feels comfortable with. So if you have a smaller NICU and they see fewer traumatic births, most births are pretty run of the mill, they may not feel as comfortable with the resuscitation process. But because of that, I know that a lot of those nursing teams receive supplemental orientation. So periodically they'll come to the larger NICU so that they can be exposed to that type of care, so that they know how to stabilize an infant before transferring that child to a higher level of acuity NICU. And it's amazing. It really is amazing. I know that you were talking a little bit about the near misses.
Mhm.
It's incredible and heartbreaking to me because I will get report from a nurse and we'll just be talking, like, they'll be going through the baby's birth history and say, oh, it was a placental abruption, a partial abruption or a full abruption, or triple nuclear cord with meconium aspiration. And I know that a lot of the things that we're talking about are pretty, run of the mill. We see them a lot, but after losing my son Ezra, I think those instances, they kind of knocked the wind out of me, because I think to myself, this baby is a miracle baby. It is a miracle that this child is here. And you're right about, about the level of skill, the level, how that is different, at lower level NICUs versus, level 3, level 4. But I think that ultimately, having had the support that you did, the healthcare, being in that environment in the first place is extremely important. Just to have that access in case something happens.
Mhm. Yeah, there's a lot of back and forth on social media about this, but I think some people feel like if you allow fear into your birth, then all these things will happen. But I was not afraid of stillbirth. I didn't know anything about it, So when it happened to me, I literally just felt a change in movement, started freaking out, started Googling, which you should not do. You should hopefully already know that you should be kick counting throughout pregnancy. And at that point, you would already know this is different for my baby. I'm going to go in. But I had to do my kick counts. I had to figure out, because I just had a long day and I was like, there must be something, he's sleeping, it's so late. And so I started reading online what to do and doing the ice water and all that stuff, which you should not do because you're just trying to, make a baby move who might already be telling you they're unwell.
Mhm.
And he didn't really react. So I started to panic and I just got my clothes on. I called the ER. They said, eat a meal and take another 2 hours, which of course I didn't. I was already like panicking. So I put my clothes on and ran over there by myself, thinking it was just a, false alarm, really. I mean, I never heard of a baby dying for no reason, just like that, like in a healthy pregnancy. So for me, it was like a total shocker. And like, I know you said you've seen it all, and a lot of people find it very like shocking when someone in the medical system has a stillbirth, because they kind of think you guys would know. Like, and I know you knew about stillbirth, so you were noticing movement and all that sort of thing. But again, you didn't think it could happen to you either because of the health of your baby throughout your pregnancy, right? Is that pretty much how you felt? And not that you didn't do what you should do, but you weren't even thinking that was the situation for you either.
I was definitely fearful through all three of my pregnancies. Um, with Ezra, my second child, I felt like something bad was going to happen. Just had this feeling of impending doom the entire time. But I feel like our stories align a little bit, because when I started to notice that something was off and I was at work, it felt normal movement in the morning, normal movement in, kind of the lunch hour. And then my shift got crazy and I just wasn't paying very much attention, but I sat down to chart and he wasn't moving, and I was drinking cold water already. He wasn't moving. And alarm bells were going off in my head, but kind of like you said, I ignored it. I thought to myself, "Oh, it's all in my head. I'm a habitually overly anxious person anyway, so this is probably nothing." And I waited about 4 hours before I finally went in. But even as, a healthcare provider, not fully understanding that the 10 kicks in 2 hours is outdated. Um, I I think I lasted about 23 minutes when I did my kick count. And then I went in by myself in the middle of the night, you know, like you do. Um, it's difficult because for despite having read as much as I did, despite knowing as much as I do, I still felt the way that a lot of expectant parents feel when it comes to asking for help. They don't want to be a bother. They don't want to be a pest. Maybe at one point or another, a healthcare provider has made them feel like they are a pest. But the truth is that you should feel empowered to go in anytime that you feel that there's something wrong. You should feel like your healthcare providers are there to help you, because they are. That's the whole reason why they exist, why that job exists, is to be there to help you when you are scared, to be a reassuring, a force of reassurance that you are doing everything right for you and for your baby. And the night that my son died, I didn't want to be perceived as that overly anxious, hysterical, pregnant individual. And I didn't go in until it was too late. And that kills me. That just kills me. I should have never left the hospital. The moment that I felt something was off, I should have walked down the hall, because, triage is right down the hall from where I work. But I didn't.
Yeah. And you didn't actually feel a change the days before, because in my situation, I think in yours as well, the cord
Mm,
compressions that happened were for days. It wasn't just an acute, cord knot that got pulled right away or around, nuchal cord.
right.
So it would have had to have been several days of a change that we would have noticed and said something about, because that's what I go back to count the kicks and stuff, because I think that would have been my only hope, because I don't think, and no doctor checks for the cord blood flow, especially for a low risk pregnancy. There would have been no chance they would have caught it. So it would have really had to been up to me to notice it for days before, and where, your baby can still act normal because he's continuously recovering. And, it's like a short amount of time that the cord was compressed and not compressed, so enough times though to cause the damage to all the organs and such. So for me, I don't blame myself, and I hope you don't either, because that would have been so hard to notice that and to be there at the exact moment, because I think I went in and yet he was alive, and yet, they took him out, crashed C-section, and they couldn't resuscitate because of all this that already happened. So, I mean, it would have been, I wouldn't have thought of it at all, because no one warned me about kick counting, how to properly do it. Why are you doing this? Like stillbirth prevention, like anybody could have a stillbirth, even a low risk pregnancy like ours, all
Mhm.
this stuff. Like I had none of that education. So for me, I feel like, why would I have imagined that my son was acting differently? And even if it was just like a little slower one day, like I would have never thought that. So that's where we go with, like, everyone should know about stillbirth. Everybody should be informed. It's not to panic you or freak you out about it, but like you get on a plane and they're going to tell you what to do in case this plane crashes. So this is the same situation, we feel
Right.
like. So
You
don't
take your
act like
baby
we're children,
home.
like tell us information we need to protect our children, because we
Mm.
are adults, women can take all this information in. I mean, we talk about listeria, we talk about all the other things that could potentially lead to this. But the main thing is fetal movement. That shows up in all the studies. Like a lot of parents who have had a stillbirth have said, like, there's a change in movement, and that was their only indication before their child, had this problem. So we're like, everyone should be educated at their doctor's appointments. And I feel like they only reserve that for the high risk patients, and they don't want to freak everyone else out. And that's really sad to me, because it's like you're totally missing an opportunity to save so many babies with that.
And the thing is that you take your baby home and they teach you about how to properly place them in a car seat in case you get into a car accident. They teach you about appropriate sleep to prevent SIDS. All of these really scary scenarios are constantly being introduced to us, but stillbirth is not one that is talked about often enough. Um,
For me, it seems really like the reason why it's continuing to be the same. Our rate is the same for many decades now here in the United States, and we're not changing anything. There's no protocol that the doctors have to discuss this. Mine was given to me, supposedly, he said, I think that you should have gotten it in the pamphlet, like that you got when you got pregnant, which a bunch of other pamphlets were in this bag. And so it's like, so along with like the vitamin ads and everything else that's not so important, you threw in like the most important thing that you think a parent should know to prevent stillbirth, and you didn't even mention it ever again. And some people get mentioned it later, like, oh, is baby moving okay today? Like very casual, conversational. No one ever influence or emphasizes that. Like, we're asking you this because if there is a change, you need to do this, you need to come in right away. So that's what's so, like, it just infuriates me, because I'm thinking, had this doctor, even at the 20-week mark when my baby started to have some movements, or hopefully closer to when they have a pattern at 26 weeks or 28 weeks, if you came in, they could be like, now's the time, you need to pay attention. If you see anything like less or more frantic, come on in. We want to see you. Doesn't matter how many times, doesn't matter if you think it's nothing, if you have a feeling, a gut instinct, you need to follow that. So yeah, I feel like there's a huge failure there of education, and I don't get it. I don't think it's acceptable. And obviously, we're trying what we can on our end with all these charity work we're doing, but it really feels like it's up to ACOG, and I keep tagging them all the time. I'm sure they're kind of like, who's this person? we're emailing and trying to get in touch with them about fetal movement education because they think that doctors do this. They think that they're supposed to be doing this and it's part of standard care. But I can't tell you how many parents tell me that they have never had that mentioned.
The lack of consistency in education is the most alarming thing, I think. Just because you get some individuals who receive really stellar education, they feel like they're really prepared. Then you have other individuals who just fall through the cracks, and they experience something as heartbreaking as this, and they never had a chance. Is the point. It's just that they never had a chance because nobody gave them the education they needed. And knowledge is power. It really is. Knowledge is power.
And do you see a lot of the parents coming in with these babies that get delivered, early, saying stuff about the fetal movement, or why are they coming in as like pain, like listen to abruption or something? Like, what are mostly like, the reasons that these babies are getting pulled out early?
Pain, preterm labor, it kind of runs the gamut. It really does. And we start to see some trends sometimes. So sometimes we'll have a bunch of kiddos who are in simply because their mothers went into preterm labor. Sometimes we'll have runs and runs of meconium aspiration. It really just kind of depends. And we talk at the very beginning of the baby's life about the delivery history, because that's the only history that a child will have, is the history that they acquire from their parent. But as they get older, that also doesn't always get talked about a whole lot. So sometimes parents will say things about the experience that will just, it makes me think to myself, you were very, very lucky that you were here, or you were very smart to come in when you did. And they didn't even realize that what they did was in any way heroic. But we do see a lot of babies that are born prematurely. The pregnant parent just goes into preterm labor, and maybe any of the extra complications that we see are discovered simply because that pregnant individual is already in antepartum and being constantly monitored. So it really depends. But I do occasionally hear stories that that sound like baby saves to me, even though these parents don't realize that they saved their baby's life.
Yeah, I know. I have this one reel on my Instagram here that is just like going wild all the time with comments, and people are sharing either a loss, unfortunately, like myself, where it was like the change in movement happened and my baby wasn't either there anymore, couldn't make it. But a lot of them are actually saves, which I'm starting to share a little bit because I think people don't think about that. Like, obviously, Count the Kicks is sharing baby saves all the time. So if you take the time to read those stories, you'll see like the fact that this parent came in for change of movement and delivered, and there was something there, like a reason why, and they had to be delivered, and otherwise they could have been another stillbirth, which is really, really incredible. I think it's like proof in the pudding, like this is so important. You need to be doing this and have the app, it's free. You can be doing that. It helps you just to kind of remind you to do it every day. And you have that graph that will then show your provider, if you ever come in, like, here's the dip, and they'll take it a little bit more seriously, we hope. which is the other problem, having a provider that listens to you, that then takes action and does more than just, check a heartbeat, which can be there until the baby's gone. So, what do you recommend for that? Like finding a good provider that you feel is going to take action when needed to get your baby out? Because I feel like some doctors are scared to get babies in the NICU and like they don't want to risk that liability, pulling a baby too soon.
Well, and when it comes to obstetrics, I know that it's been mentioned before in some of the lives that we've done in the past, or or some of the lives that you've done with other individuals, but the name of the game when it comes to obstetrics is in or out. At what point do you take that baby? At what point do you deliver? And it's when it comes to finding a provider who is going to be a champion for you, it helps ultimately if before you're pregnant, you find somebody who's on board with all of the things that you need. And that could be estimated placental volume, just measuring that placenta, kind of armoring yourself with the knowledge that comes from Count the Kicks and organizations that will give you information about how to prevent stillbirth. I think the hardest thing, one of the most difficult issues that pregnancy after loss parents have encountered is finding a provider who will do estimated placental volume, who will maybe do some of the extra testing for clotting disorders. It's like Sam says all the time, you have to really vote with your feet and go to a different provider if the one that you have found is not on board with what you need. And that can be a difficult thing. It could be hard to find somebody who is going to be there for you, to provide the care that you deserve, honestly. Every pregnant individual deserves the level of care that a pregnancy after loss parent receives, period. The fact that it's not standard of care is just tragic to me. It's not okay. But if you find somebody who is on board with doing everything that you feel that you need, then you've struck gold.
Mm-hmm. And I think like the biggest thing is because of the way pregnancy is talked about, like that you can do it at home by yourself, or it doesn't really matter who your provider is, like your body is going to know what to do and your baby's going to know how to be born when he needs to be. All this talk, I think, actually is making women second guess themselves even more in a way, because if you feel something like intuitively is wrong, then you're like, no, I'm just freaking out. I'm just being fearful, So you try to like quiet that and just, trust your body, trust your baby, and that sort of thing. And I think that's where I get so frustrated with that whole line of discussion, because I think it's beautiful and nice and it's good to go into things with like the best intentions and feeling great and giving your baby all the good vibes, but then you're not taking seriously certain signs or risk factors that you might have. So for me, I just want to make sure that people who are listening, who are pregnant, take in the fact that stillbirth happens actually more often in low risk pregnancies. And so that is our case here. And we were perfect, healthy, normal pregnancies up until when it happens. So we all need to take all of this very seriously, all the way through. And if you're planning whatever type of birth you're planning, at any point, if you have concerns, you need to get checked out and as thoroughly as possible, because they might do certain tests and not others. They might do an NST, which is great, put you on there and check everything, but that might not be long enough. You might want to be overnight if you still feel like you aren't reassured, which is what Dr. Florescu always says, one of our advisors at Push. You need to be the one that's reassured, and the provider should be asking you that. Are you feeling better now? Are you reassured with everything that we've shown you that your baby's fine now? Don't go home without your baby. I mean, that's what I had to do for my pregnancy after loss. I was just like, I'm not leaving. At this point, I had low fluids. I've had all these complications. I've had a stillbirth. I've had 2 miscarriages. We were at the end zone, the past 37 weeks. I said, I'm not leaving without my baby. If you want, go ahead and take him out now. But he ended up keeping me the last week there. And I was so happy to be on a monitor the entire time. Like, that was the only time I rested at all in the pregnancy, because I was like so afraid I was going to miss a change in the movement. So of course, at the end, he did start to want to be born earlier than we thought. So it was 37 and a half weeks. I had some contractions, and then I got to have my C-section. But I wasn't willing to go home, because I already knew I had low fluid. I'm like, I'm not letting this happen again, but I was totally in a different mindset because I realized the risk was there.
Well, and so when I was in nursing school, I remember one of my professors talking to us about when to ask for a second set of eyes, when to say, I don't feel good about this. Something doesn't feel right about what I'm seeing. I need somebody else to take a look. And they said that sometimes there's just a gut feeling that nurses get. I feel like that's the case with humanity, with anybody. Another thing that they said was to listen to somebody if they were very afraid, if suddenly they had these feelings of impending doom. It's hard to give in to the fear that you have, but that is your body also telling you something. That something is not quite right. Listen to it and trust it. Trust that you know what you're doing. But if your mantra is my body and my baby know what's going on, and they are the ones who will guide me through this birth process, then listen to that fear. Listen to that gut feeling that something is not quite right. And don't be afraid to ask for help when that feeling does come, because you are more powerful than you think you are. You really are.
So you just said, listen to your fear. And I put into Instagram birth without fear. And there's at least, I don't know how many accounts that go with that. I don't even know if that's a thing. Special hashtag. So it's really funny and ironic that there are people out there that want us to birth without fear. And yet the fear, I think, is instinctual. It's something that anyone, they compare us to mammals all the time on these accounts. Like, they are able to give birth without a doctor. Why do you need it? Like, well, the mammals also have instinctual fear, and they know how to protect their offspring in certain situations. So I have a hard time with all that. So like, you kind of need the fear to alert you. You need to know about it, not to be afraid all the time, but to be aware and to be doing what you need to do. I do have fear now. I mean, my children are out now, other than the one you lost and our miscarriages. The other 2 are here and out of my body, running around. And I'm afraid for my life every day. It's still, as a parent, because you worry about your kids. You're going to worry about them the rest of their lives, right? So
that's the reason why you worry when you smell smoke. Or why our taste buds are equipped to detect something, like why it is that we don't like certain food certain tastes because it tastes poisonous. Those are that's your body telling you that something is not right. And so in regard to you and your baby, just make sure that you're listening to that too. There have been several accounts, at least with my nursing professors and my nursing peers, where they've said, the patient just looked at me and said that they don't feel quite right. They can't put their finger on what it is that's not right, but they know that something is not right. And lo and behold, you find out that maybe there was a GI bleed that you wouldn't have noticed until much later. Or they're experiencing a heart attack. Maybe you have a woman who's experiencing like just a lot of fear, anxiety, in addition to like acid reflux or something like this. This doesn't feel right. And, listening to that is important. Listening to that saves their lives. Listening to that saves your baby's life. Trust it.
I love that. And I'm going to let you end on that, Angelica, because I know we started late and it was my fault. Life happens, right? We have with Push for Empowered Pregnancy, we're celebrating the National Rainbow Baby Day. And I was posting a cute little reel of all the babies that have come after loss. So anyone who wants to watch that, go check it out on that account. But, we celebrate them because it is such a miracle, like you're saying earlier, that any of these babies are here, especially after loss, because we actually have a higher risk of stillbirth. So for our pregnancies to go well, we do need an additional level of care. And thankfully, some of that is available now. We do have the Rainbow Clinic in Mount Sinai. So if anybody is pregnant again, please check that out if you're in that area. If you want training, if you're a provider, there is a Rainbow Clinic training available as well through Push for Empowered Pregnancy. So we welcome you to check all of that out. And we thank you all for listening. I know this is always a difficult conversations when we actually talk about the real stuff, but I think that's what we need in this time. I mean, that's the only way we're going to prevent losses is by discussing them.
We want to prevent you from feeling the heartache that we do on a regular basis. As a nurse, I think I had some degree of understanding of what it was like to lose child. I'd witnessed it happen before, and my heart broke for these families. But what I saw, or what you read, what you hear about on social media, and the heartache that you feel, it doesn't even scratch the surface of what it actually feels like to lose a child. And it is our endeavor to make sure that nobody ever feels this pain ever again, if we can help it.
Right. And we welcome you all to join us too at the Big Push March in Washington, D.C., which is October 15th for Pregnancy and Infant Loss Awareness Month. It'll be a time for anyone to come together. You can do it virtually as well. So please sign up for that, thebigpushmarch.org, and let us know that you're there to raise awareness about this. And the more we discuss it and the more people outside of the loss community know about it, the less people that will have to come into the community. So thank you again, Angelica. I love you so much. I love Ezra. I love Fletcher. I love all your babies. I mean, it's so funny how much we get to know each other and our babies through each other. So thank you for sharing them with us.
I love you too.
Everybody have a nice day. Bye-bye. Angelica is such a sweet, wonderful mother and advocate. I hope that you gained some great information from this episode. I know that it was sad and somewhat scary, but we think that you deserve to know all the information. Remember to share this episode on social media so you can help others in your circle grow their knowledge and have a better birth outcome. Remember that all the posts that we share and our episodes are not meant to be medical advice. We are simply trying to help you and inform you as you continue your pregnancy, but always remember that you should consult your provider if you have any questions or concerns. They're there to help you and they are available to you 24/7, even if you have to go into the hospital or the ER. Again, follow us on social media to continue up to date with our next episodes and our posts, and feel free to connect with us in the DMs. If you have any questions, we would be happy to be there for you. You are not alone. This is your community, and we hope that you will continue to watch our future and past episodes to continue to add to your knowledge as we interview birth workers, providers, researchers, and even people who have experienced different births, so that when you get to your birth, you'll be a little bit more informed and prepared for whatever comes your way. Goodbye for now.